More than 37 million Americans are living with diabetes. But during holiday time, it may be a challenge for some to manage their health while also wanting to partake in holiday celebrations. Avni Lal has more with Dr. Ken Redcross, an internal medicine physician.
Dr. Redcross, thank you for joining us today.
Thanks for having me on, Avni.
Diabetes care routine during the holidays can be a challenging experience.
Yeah.
How should you manage your blood sugar during the holidays?
So look, during the holidays, guys, this is the best time for us to think about our relationship with sugar, how much it really impacts our lives. Now, sugar is not always evil. It's only when it's out of balance. But if it's not during the holidays that we think about our sugar, there isn't a better time to do so.
So let's talk about some of those warning signs, right? Dangerously high blood sugar levels that can be easily missed.
Yeah, so look, as you think of these warning signs, let's really pay attention here because they can be somewhat non-specific. We're talking about fatigue, pretty common for some of us, right? Increased urination, increased thirst, and also blurred vision. So these are important signs and symptoms, not to just blow off to like my women will say, well, I'm going frequently, maybe I have a urinary tract infection. Or my guys will say, well, maybe it's the prostate and kind of blow these things off. No, this is a time for us to really think about, is there something going on with my blood sugar or not?
And so what are some of those tips? How can you manage your blood sugar and how can you control it?
Well, look, when you think about this, I talk to everyone about making sure that we avoid the white foods. That's white bread, rice, and pasta. These are things that are enriched, everyone. They're not necessarily full of really good nutrients. And so they break down into sugars. So as we think about that during this holiday season, that may be things like mom's stuffing. Some of those things, we can't necessarily enjoy all of that. We need to be very, very mindful about what we're putting into our body that can break down those sugars.
And let's talk about sugar substitutes, right? Studies have linked sugar substitutes to increased risk of heart disease. So what are your thoughts and do you recommend anything in particular?
I do. So this is fascinating, everyone, because we always had this thing about sugar in our lives and in our diet. So then we get these artificial sweeteners thinking, well, they have to be better, right? Well, they aren't. We're realizing that the artificial sweeteners also not only can increase obesity, but also affect our microbiome. And that's what we do not want nowadays. So there's really only two forms of sugar that are natural, everyone, maple syrup and honey. Those are the only things I use. I promise if you come to the Red Cross household, you'll see one or the other in order to make sure that you're sweetening, but you're sweetening properly.
And diabetes is asymptomatic during the early stages, right? So let's talk about the genetic component of this. Can we test genes for type 2 diabetes? How can we catch this disease at an early stage?
Oh gosh, Abby, that is a fabulous question. So I'll tell you this, everyone. So there's two types of diabetes. There's type 1 and type 2. Type 2 are the ones that most of us have that we're talking about today, and that's about 90% of diabetes. There is type 1, which tends to be more familial, but you usually find that out earlier, a younger age, when you start to see that something is wrong. So there is a way to test in a sense, but usually for type 1, we find out that there's something awry there.
And doctor, in terms of the diet for diabetics, right, during the holidays, what should they stay away from?
So look, guys, so there's a few things to stay away from and to consider. So I already mentioned those white foods aren't good for us. Bread, rice, pasta, they are not good for my diabetics. But what's out there that can make a difference, right? Look, there's a lot of things we're talking about with balance of diet, right? We want to make sure that we have brown rice. We want to make sure that we have more beans. Those things are important. To make sure we're eating lean meats, Mediterranean diet in a sense. But there are some things out there. There's a couple of supplements out there that are showing the benefit in supporting your blood sugar. Cinnamon is a fascinating one as we're doing more on. Another one is berberine. It's a type of bark, Abney. And the thing I love about berberine in particular is not only does it help support the blood sugar, helps support elevated cholesterol, that bad cholesterol that we don't want. So when you think about berberine, which is just the bark, you're like, wow, these are some things that I can add into my diet, and make sure you go out and realize where you can get these supplements and things in addition to eating the right foods.
And it's important that you mentioned cholesterol because diabetes is not only the sugar issue, right? We also have to worry about inflammation, correct?
And I should also say this, and I'm glad you brought that up, Abney, because when we're talking about diabetes and elevated blood sugar, it's more than just a diabetes story. It's a heart disease story. It's a kidney disease story. It's a brain disease story when you're talking about inflammation, which I like to say causes dis-ease. And once again, we get back to that balance thing that we're all trying to attain.
Finally, doctor, I want to talk about in an emergency situation, right? Whether your sugar levels are too high or too low.
Yeah.
How can you help someone immediately before the ambulance gets there? What can you do to help?
Look, the best thing you can do, especially if you think that there is a blood sugar issue, and this person's been telling you about signs and symptoms, are hydrate. Think about this. You have all of these blood sugar molecules, and someone that doesn't realize that their blood sugar is through the roof. You have to dilute that stuff. You have to really dilute it and get diluted and get hydrated. That's what happens when they get to the hospital. They put an IV in and get it started. But the main thing is to try to dilute all of that sugar in the bloodstream.
Dr. Redcross, we're going to leave it there. Thank you for the information.
No problem. Thank you so much for having me on.
That was Dr. Ken Redcross, an internal medicine physician.